the same time every day, you may think you're safe, but an extra serving of soy or a dose of antibiotics could change that. Here to tell us about drug interactions, we'll take a look at those drug interactions with Alvarado Hospital's Dr. Lila Schmidt. Good morning, doctor. How are you?
Good morning. Very well, thank you.
Thank you for being with us, and we want to talk about what women don't expect when taking the pill.
What they don't expect?
In terms of drug interactions and other medications that they may be taking. What are people not really aware of that they should be?
That's a great question. A lot of women, when they're taking birth control pills, well, the most common call I'll get is, I'm going to take an antibiotic, will my pill be affected? And most antibiotics don't affect the pill. It also depends on when they're taking the pill. Mm-hmm. Are they taking the antibiotic in the first half of their cycle, which is more important in preventing pregnancy, versus the second half of their cycle? And so if they're on a short course of antibiotics, it depends on what antibiotic and where they're taking it in the cycle.
So that's one of the first questions a doctor is going to ask: where are you in your cycle?
Yeah, no, I'll look up and have to think, well, what week am I on?
Right.
And so, yeah, and also depends on the patient.
Okay.
The pill is metabolized, which means it's degraded, chewed up by the liver. So anyone that has liver issues, whether they're a heavy drinker or they have hepatitis or they've had hepatitis or gallbladder disease, that's a real important patient that you want to try to steer away from the traditional birth control pill.
Okay.
The traditional birth control pill has estrogen and progesterone in it. It's the estrogen part that can cause the problems. So there's alternatives to these women. They could take a progesterone-only pill called a mini pill. Mm-hmm. They could take Depo-Provera, which is an injection of progesterone. They could use barrier methods. So it depends on what the problem is, how long they're taking the medication, and when they're taking the medication. That will determine if there's going to be an issue.
And as you were saying, it really depends on the patient themselves as well. I mean, I think in medicine a lot of people often assume, well, if it didn't work for my friend, then that's not going to work for me, or if she had this interaction, I'll have that interaction, but not the case.
No, it's exactly true. You'll say, if you have 10 patients and you give them the pill and you give them the antibiotic, 7 of them, no problem. 1 of them will have a problem, the other one won't even know. So it's true. Not every patient is treated the same, and if you do treat all your patients the same, you're making a horrible mistake, because you are different than the next woman. Mm-hmm. You have different needs, different problems, different issues that need to be directed individually. That's why it's so important to see a physician face to face and to give them all your history, all your medications, and be truthful so that they can give you the best care.
And speaking of history, what if somebody has a long-term history of long-term antibiotics for some sort of other illness that they've been dealing with? How might that affect the pill use?
Again, it depends on the person, what antibiotic, why are they on it, and another thing is, why are they taking the pill? Do they need it for contraception? Do they need it because they're trying to control acne? Are they trying to control heavy menstrual flow or bad menstrual cramps? Because there are other things we can do. So you have to, at least what I do, is weigh the risk versus the benefit. And if the benefit is greater than the risk, we'll do it. If it's opposite, then we'll find some other alternative, because there are several things you can do besides birth control, the traditional estrogen progesterone pill.
And what about herbal remedies? Let's talk a little bit about that.
That's a very good question. A lot of women will come in and you'll ask them, oh, what do you want? Well, I'm on birth control pills, I'm on vitamin C, and I'm on, whatever. And I'm on herbs. Okay? Which ones? I don't know. And it puts me in a very hard position, because I don't know what they're on at that point. I'll put down unknown herb and then try to get the patient to bring them in, mm-hmm. or trying to get the patient to ask the person who's given them the herbal medication what's in it, because it helps me to help them if I know what they're taking.
So that's just as important for you to know if they were taking some other antibiotic. It's just as important to know what type of herb as well.
It's important to know everything about them. Mm-hmm. It's important to know about their diet, their exercise level, their weight actually is extremely important. I've had more patients who've had pill failure because of their weight.
And you were saying anything over 200 pounds when we were talking earlier, is that correct?
Any woman over 200 pounds has a statistically significant higher risk of pill failure. I've had more patients come in, even though I get women pregnant, that's my job, and do general gyne, but they'll come in and say, I took my pill every day. I took it at the same time every day. Here's Junior Bird. Right. But if you ask them, what did you weigh when you were taking the pill, if it's over 200 pounds, it's very wise to counsel them, you may have a risk of pill failure just because of your weight.
So what is the one most important thing you would want to let women know about this topic?
2. your weight, and if you have a clotting disorder. Women have clotting disorders and don't even know it. They'll have a classic history. They'll come into me saying, I've had 3 miscarriages. They have a clotting disorder they don't even know about. And estrogen sets off that system that could cause them to have a clot that could go to their brain or their heart and have a dangerous outcome. So that's something we test for.
Okay. Very good tips and good information to know. Thank you so much for being with us this morning.
Thank you for having me.
All right. Well, for more information, you can go to san diego6.com.